Well, good morning everybody, welcome back to the channel. Motorhoming fun. As you can see, we're back out again on another walk this morning, and I'm just going to let you know about how my MRI scans went and my visits to the consultants this week. I'll start off with Wednesday. On Wednesday I went to see Mr. Shukla at the Woodlands Hospital in Kettering. And basically I've had a bad shoulder for the last 15 months. Had an MRI scan and it's picked up a few things which I shall mention. Initially I had an ultrasound back in December where they picked up just an inflamed tendon. In January I had a cortisone steroid injection, and I had literally no effect on it. So a few months down the line, had a chat with a good friend of mine, my GP, Katie Bland, and we recommended we'd go for an MRI scan. And 7 weeks ago I went over to Corby Diagnostic Centre to the mobile scanner and had the scans, one on my back and one on my shoulder. And 6 weeks later down the line, we picked up the results, and they weren't too good, to be honest, guys. And that, so on Wednesday, as I say, I went to see Mr. Shukla at the hospital, and basically I've got a rotary cuff tear. I've also got 6 or 7 other tears around the shoulder. I've got ligament damage, cartilage damage, bursitis in the joint, and obviously I've got the inflamed tendons as well. So I'm going to have major surgery shoulder to put it all right, all the repairs and cleaned out, etc. So yeah, so we're going to be on the NHS waiting list for that over the next few months. Not too sure what the wait is, 3 months, 6 months, 12 months, but at the end of the day it's not going to get better on its own, so we've got to have the full repair done. And that's so yeah, so that's the shoulder basically. Recovery time for that can be anything from 3 months, 6 months to 12 months, depending on how severe he finds it when he gets inside. So yeah, not great on that one. So yeah, now for the back. Right, now for the back. I'll just tell you briefly a little history. The last 20 years I've had constant back problems, and basically the last 18 months, 12 months, it's getting progressively worse. Initially I hurt my back about 20 years ago, as I say. I just pulled a electric lead out from the rear of somebody's settee while working on a job, and I injured my back that way. I've had a few sessions with osteopaths in the past and all that, and we got me back going again. But as I say, recently it's been getting worse. Work at day, by lunchtime my back is absolutely killing me, and have a job by the evening to even sit down and walk. So as I say, we went to see the GP and she suggested we'll get the shoulder scanned and the back scanned at the same time, which was, as I say, 7 weeks ago. Excuse me, just looking at the dogs. And as I say, the initial reports come back not very good on the back as well, and that nothing major, nothing sinister, but no breaks. There's no cancer or tumours or anything, but I got a significant bulging discs lower down, curvature of the spine. But the main problem with the pain is I've got a trapped nerve between discs L4 and L5. So yeah, as I say, I went to see Mr. Shukla on Wednesday at Woodlands Hospital, and had a quick mention with him, and he recommended I see a spinal surgeon, back surgeon, and he sort of organised it there and then for me. So I paid for a private consultation on both of these matters over the last few days, and this is Saturday the 1st of June. Had my appointment at 8 AM this morning. Went to see him, and long-term prognosis is I'm probably going to need back surgery and that, but that is last resort at the moment. He said down the line, yeah, I'll probably need it, but not at the moment. He also said about the injection, steroid injection, but they're really short term as well. Right, so at the moment he suggested physiotherapy at the moment, so luckily I know a very good physiotherapy. Actually built her new physio room last year, and that Charlie Buckerfield, and that, so I've rang her this morning, and she's going to get back to me later today, and we're going to organise a few sessions of physio and that to see if we can get me back working a bit better. But as I say, long term down the line, we might need surgery. There's no actual disc on or anything, as I say, no fractures. Spinal cord is fine, it's just literally a trapped nerve. I get a lot of lower back pain, and also I get the top of my thigh and my leg and my buttock cheek. I get like a muscle spasm go down it. So yeah, so that's my back and that. So, but long term at the moment, I need to get my shoulder fixed, and that, as I say, I'm coming up to 60 next year. You know, my aim was to get to 60, possibly retire, and that. I've got a private pension due next year, but it wasn't going to fund me enough or give me enough to live on until I'm 67, and that to get state pension. So as I say, I do want to keep working. As I say, I need to get this shoulder fixed and get back in the building trade again, guys. So sorry, it's a bit of a long rant and a rave, but I thought doing this little vlog video would put you all a bit in the picture of how things were with my prognosis. So thanks again for watching, guys. Don't forget to give me a thumbs up, a like. Don't forget to comment and subscribe. We're off to South Wales in the motorhome in about just under 3 weeks time now, and that, so come along with us, see what me and Sky get up to. Obviously when I do get my shoulder done, the travels are going to be put on hold for a few months and that, guys, and that, but we'll keep doing what we're doing, guys. As I say, we love it, love the drone flying as well, and we'll catch you all soon, so bye for now.